I was born approximately 3 months premature, and that resulted in spastic quadriplegic cerebral palsy from a intraventricular brain hemorrhage, which is the reason that I use a power wheelchair. And so I've been in and out of hospitals literally since the day I was born. I've traveled throughout the state and throughout the country for specialty care, mostly pediatric specialty care when I was younger. I'm 27 now, so, but the main thing about the healthcare, there are two big barriers in the healthcare system as I see it, and that is the transition from pediatric care to adult health care for people with disabilities and complex medical conditions, because we're living longer now and we have complicated medical histories, but adult healthcare providers are not used to dealing with the kinds of issues that a lot of folks who were born with disabilities or who acquired them as children have. And so when you go to see an adult provider, they act like you're a space alien, whereas a pediatric specialist gets it. But a pediatric specialist typically does not see anyone older than 21 years old. So there are major health disparities for people with disabilities that don't exist for people without disabilities. And the second big barrier to access to care, another barrier to access to care, is physical access to the spaces to receive the care. A lot of the offices that you go into, the exam tables don't raise and lower. They don't have patient lifts to lift you onto the exam tables. Doorways may be too narrow. So you might not even be able to get into a provider's office. And then there are also attitudinal barriers. Providers who don't have experience with people with disabilities may be scared that what would be a routine procedure or a routine exam for them to perform on another patient, they've never done it on somebody with a disability, so they may be hesitant or may turn you away. And a third barrier is that a lot of folks with disabilities rely on programs such as Medicaid and Medicare for their health care coverage at the moment. And especially with Medicaid, not a lot of healthcare providers take Medicaid, so it takes a while to find a primary care physician. And then even when you do find one, they may not have any experience at all with your disability or how to deal with that.
I'm an independent self-advocate at this point. I haven't joined up with any of this. But I foresee a time whenever I might even form my own group or at least coalesce around people with similar. Actually, GIMP Girl Community is who I'm here representing, and we do, it's not our focus, healthcare isn't our focus, but we do talk about healthcare a lot. It's an online organization for women with disabilities, and we have weekly support meetings. And it's surprising how often healthcare comes up, and we have women who, from the age of 16 all the way through their 80s and 90s, who participate with us, and they're from all over the country and all over the world, and we all have similar struggles, even in different healthcare systems. A lot of people are afraid of changes to the healthcare system, and it's like we're not so much different than, I mean, those systems aren't so much different from our own. It might sound like it, but they're not, and everybody has a lot of people have the same struggles, but also the same triumphs. And if we get together and we talk about those and share our experiences with one another, we draw strength from one another, and then hopefully we can go out into the community and talk to folks that can make a difference. I have had some experience, not as a formal speaker, but as just as a student on a campus where physical therapy and nursing were very prevalent, and so I think that in an indirect way I had some impact on some of those students that I came across, and I think they sort of left with a different impression of people with disabilities than maybe they came in with, because a lot of physical therapy students I've come from a perspective of wanting to do things like sports medicine and work with athletes, or they have the athletic injury, but they don't have so much experience with people who've had either congenital or acquired severe disabilities. And once you meet somebody, it changes your attitude and it changes your perspective. And I've had people come back and tell me that years later, I've had people come back and tell me that spending time with me for a few months or a year completely changed their outlook on their profession and how to treat patients, and I think that's the ultimate compliment. My hope is that future professionals in all health disciplines can kind of take the same approach. Maybe they watch this video and they hear that the ADA was passed, over 2 decades ago, and it had language in it that mandated certain accommodations in the healthcare environment, but we're not there yet. And we've had training. These people have had more training now on holistic approaches to medicine, but we're not there yet.